This is a brief introduction of the presentation of the CancerAppy platform. You may click onto the website and you will get a screen with different operations. In this case, we are going to use the GeneReport dataset. Once you get here, you will see the GeneReport Personalized Medicine. This function is designed specifically for physicians who receive information about molecular alterations in the clinic, and they have to make decisions based on the genomic report that they are receiving after using a gene sequencing report or a genomic platform. In this case, you would upload the information about those molecular alterations that you have received from the report of your patient. You could directly click here and use it as an example. You would import this and the software automatically will identify the alterations. You may also include individual alterations to introduce the specific mutation on this site. This is specifically designed to recognize all the different alterations and then give a value. You may then go to select your tumor type. In this case, you may go for the tumor or tumors that you are specifically looking for. For this case, we are going to use breast cancer as an example. I will go here and I will just generate your report. You will get the information that we have and use the drop-down bar to scroll down and see that information is on display. The name of the report, the date, and the diagnosis that we have introduced. You will get the information about the biomarkers, identify which one of those are actionable, the machine drugs, and relevant combination. Everything is clearly shown in a beautiful and succinct screen, so you have it available so quickly. A brief information about the drugs that you can easily and quickly see when you scroll down to the description of the biomarkers. You will get information about the genes, the biomarkers, the specific mutation, the gene variants, proteins, and which are actionable and which are pathogenic. This could be very useful for your pathology colleagues, and discount options are available. There is a complete summary of the gene that has been identified and the intensity of the mechanism of action and the copy of the variation or the potential for druggability. When scrolling down through the drop-down menu, you will get into the information about potential therapies. First, we get on a scroll based on the match of the drug with the gene. In this case, we get data, so we will get information about drug interactions and warning, but a full description of the drug would be on display. When we click here, I will show you that later, and we can scroll down with different PARP inhibitors, and then we go for top combinations that have been approved, and we see here that combination is approved. We will have a full description of the drugs, the mechanism of action, and finally the definitions of the headlines that we have used. Finally, I will show you how the descriptive information is displayed. I will show you particularly the first one. We can go here and get the information about the indications and the very useful information about the dosage, administration and the mechanism of action and best reactions, but also any warnings about this medication. We can get information about toxitis, which can be very helpful and useful when you want to prescribe this for your patient. And finally, if you have any doubt, you may also click here, and you will get information about the full description based on the FDA. This is a very brief summary of the operations of the CancerAppy platform and its usability and functionality to improve the healthcare of your patients.